So one thing that I've noticed after being in practice since I was 7 and being in multiple types of practices and just being around other practitioners that are also in other types of practices is this crazy cycle that we all live in when it comes to pain and musculoskeletal care. So I drew it out on this little dry erase board, so bear with me. I really want you guys to see and figure out maybe where you're at right now, because this could be a huge problem for you and you could be going down a spiral you don't really realize you're even going down right now. Hopefully I can catch most of you when you're very young and you don't even start this cycle, because it's not just a cycle that goes around, it's a funnel that takes you down. And it takes you down ultimately to over here, drugs, and hardcore drugs usually at that, okay? So most of the time people get pain, right? They start with pain. They have an injury, they have just an old injury that they can't deal with that just hurts, right? And so they eventually go to somebody. And so this is, again, this is gonna be a little bit time consuming, but please stay with me. I'm gonna try to keep this quick and brief. So you have pain. Most people go to their medical doctor first. Not everybody. Some people will go to chiropractors, things like that. Chiropractors are going to focus on function, but a lot of chiropractors or a lot of people use chiropractic only for pain. So when they get out of pain, they stop going. So then they end up here. Let's just say, you know, they go here to physical therapy or a chiropractor, a conservative type of person that's really looking to try to get you moving better. But they do it for a short period of time, so then they end up right back here in the pain cycle, right? So that's another little side caveat. You'll see all these little dotted lines, and I'll get to those in a second. But most people go to their medical doctor. Now, the door you walk into with your first bout of issue or a pain, and this goes for any condition, but we're going to talk about joint pain and musculoskeletal, like neuropathy, etc., all that stuff. So pain, you end up doing a doctor, they're going to give you muscle relaxers and painkillers. That's usually the standard of care for most docs. They're going to give you a short burst of this to see how you respond with it, because they think, oh, it's just pain, it's going to go away. You don't have pain on accident, right? Pain is a signal. Pain is something that you're supposed to have. God put that in your body so to warn you there is a problem. If you cover this up, it could become a bigger problem. But most people, we don't have time, right? We don't want to mess with it. So we go here, we get a prescription, we get our muscle relaxer, our painkillers, etc. So we end up here. Now, these don't work, or they stop working, or whatever the case may be, or maybe they do work, even worse. And then you end up here again later down the road, and then you need stronger pain meds, or you can always fall into any one of these cycles for a year or 2 or 3, but ultimately the cycle still remains because it works every time, unfortunately for you, but fortunately for people that are constantly treating you, right? Because they want to, it doesn't pay for them to get you out of pain. But ultimately, prescription. Then you go down to what's called interventional pain. Now you may bypass that. That doctor may send you to PT. The problem with PT is not that PT is bad. The problem with PT is your insurance only pays for so much PT. And so what happens when you're done with that PT? Even if it works, what happens? You stop doing the PT, you stop doing the stretching, and it's okay. You're human. It doesn't hurt anymore maybe. Or maybe it does still hurt, so then they send you to interventional pain. Interventional pain is when they do injections or of steroids. They're not, most of the time, not thinking outside the box, not doing things that are any different than they've done for the last 25, 35 years, right? Interventional pain. They're going to go in there, they're going to do injections. They're going to try to be even if they're perfect and they put that medicine right where it needs to be, the problem is that medicine doesn't fix the problem, right? The problem is what caused the pain, not the pain causing the problem. So they're fixing the pain, but what happens is you're never fixing the problem. So you end up right back there because the pain comes back. And so you get that interventional pain. So you may get a nerve ablation, you may get injections or facet blocks or all these things, which are all well and good, maybe used once, right? But you still have to go back to what caused the pain. So you have to go up here, right? You have to find the cause of the pain, the cause of the dysfunction. So this is where we have to go for the cause, right? Because the cause of the pain, who's addressing it? Prescriptions aren't addressing the cause, right? Interventional pain is not addressing the cause of the pain. And so the pain always comes back. PT, yes, can be potentially causing, or not causing the pain, but, sorry, my phone kicked a message and I couldn't see what was going on. So we're going through the cause, right? So never fixing the cause. So what's going to happen after interventional pain either doesn't think they can do anything or stops working or whatever. Maybe the first 2 steroid injections work, the third one doesn't. So again, they're never addressing this. So now they're going to go more, so we're here, interventional pain. They do some PT, your insurance benefits wear out, or they're not looking at it right because not all practitioners are considered equal, okay? Just because each people have 2 PTs are in a room does not mean that they know the same thing. Same goes for chiropractors, same go for dentists, you name it, insurance agents, it doesn't matter. Everybody has their own approach, so you have to find somebody who really works with you. If all you're wanting to do is deal with this, yeah, you can use those folks and that's fine, and they'll be glad to treat you and take care of you. We have those patients in our office. We love them, we're trying to help them, and we're gonna try to give them things they can do to help ultimately fix the cause. But that's not up for me to decide or our other practitioners here in this office. But interventional pain, maybe a little rehab or whatever, but then you end up in interventional pain. We saw this all the time when I did pain management. These people would be constantly in the office. But what happens? Eventually, these interventional pain techniques do not work anymore, so then they go to an orthopedist. Many times, you'll go from here straight down to an orthopod. They won't even go to orthopedists. It depends on the relationships that these doctors have. So it's not always what's best for you, but it's also who does Dr. X know? Who's his buddy? Well, his buddy's Dr. Y, so he's gonna send you straight to orthopedist, potentially. Again, these are all potential scenarios. But I want you to understand is the circle remains the same. It doesn't matter if you bypass, you're just gonna get there quicker, right? Because some orthopedists will do interventional pain. Now, I know I'm talking very quickly, but I'm trying to get through this quickly. You may go from prescription, a little bout of PT, it didn't really work that well. I did 3 weeks of it. I mean, I've only had this knee arthritis for the last 15, 20 years, but 2 weeks of PT didn't fix it. So now I'm gonna go to this orthopedist. Orthopedist says, well, maybe try a little bit of PT. I've got to satisfy your insurance company. I got to try a little bit more conservative care. We're going to try a little bit of PT, but I'll see you back in my office in a month, okay? Or I may do a little interventional pain myself. I'll do the injections. You don't have to go to a pain management. And understand, pain management, they are managing your pain. They are not fixing your pain. They are not trying to help you heal from your pain. They are managing your pain, okay? Financial managers, you keep them forever because they are constantly managing your money just as they are managing your pain. They're never fixing your pain because they're never addressing cause, potentially. Not all are created equal, but this is the general idea, right? So we have orthopedists. Most orthopedists, after a while, maybe interventional pain doesn't work because nobody's addressing the cause. So now we end up in surgery, right? We're fixing, we're cutting in there, we're cleaning it up, we're replacing it, we're doing all these things. Not all orthopedists are bad. Not all interventional pain management is bad. Not all prescriptions are bad. But we have to understand we have to step out of this cycle at some point if we want to get a different result, right? These people fill roles, but they do not, ultimately, their job is not to help you with your cause, it's to help you with your pain. That's their job, and that's okay. But you as the consumer have to start figuring out, well, I want to get better. I don't want to end up in surgery, because the problem is a surgery usually doesn't end up one surgery and then you're done, right? You have one surgery and then you may have to have an additional surgery and then you may have to have it replaced, and then, well, that's replaced. Now I got scar tissue, nerve damage, et cetera, et cetera. Now I got to end up having all these other things done. So then those surgeries, maybe being 1, 2, 3 surgeries, okay? Everybody's different, but ultimately, no one's addressing the cause. No one's trying to get you healing. So then you're in pain. The surgeon can no longer cut on you because he's done everything he can do. He's fused you, he's gave you laminectomies, he's replaced that joint twice, 3 times. I mean, you see it a lot. Now you have severe neuropathy in that lower extremity. You can't hardly walk because you can't feel your leg because the nerves have been damaged so badly for that knee replacement or whatever the case may be. Again, and that doctor did everything right. They are just doing their job and trying to get you feeling better. It is your responsibility to step out of this cycle, not for them to try to say, hey, stop right here. Go start looking at the cause. Find somebody who's going to do that, right? So then your surgery, you're in interventional pain. Now you're on drugs, right? Now you're doing shots. Now you're doing nerve stims. Now you're doing pain pumps where they're actually injecting hardcore medication into your spinal canal because they can't give you enough orally to keep you satisfied. Then you're on to opioids because nothing now works because no one has ever addressed the cause. So now you're going to end up on opioids because you have gotten sucked into this and you have never had anyone address the cause. I apologize for the long video. I hope you stayed with this because this can change your life if you step out of it. All you have to do at any point in your life, it never matters. As long as you have a heartbeat, God will help your body heal itself. There are things out there now, regenerative medicine, just good quality physical medicine, that if you stick with it long enough, if you invest your time, and maybe you have to invest a little money, it's dependent upon you, how bad the injury is, etc. You invest those things and address this, your whole life will be different. Your whole life will be better, and you will not be dependent on something outside of your body that is dangerous, that hurts you, that creates addiction, that can cause all sorts of problems. You're not dependent on that, and you're trying everything that you possibly can to get better and get your body healing better. God bless you. I'm Dr. Ryan from Infinite Wellness Integrated Medical here in Glen Carbon. I hope this makes sense. Share this with your friends and family. Doesn't matter where they're at in the world. This is the cycle that does not work in musculoskeletal pain. So step out of it.